If someone tells you that they have got hypo or hypoglycemia, what they mean is they've got a blood sugar which is less than 4 millimoles per liter or 70 milligrams per deciliter. You guessed it right. Today we are going to be talking about hypoglycemia. Hi everyone, this is Dr. Shabri Hussoor, physician and GP with special interest in diabetes from southwest of England, also the medical director of Adisha Health. Hypoglycemia is a common occurrence in patients with diabetes. It's more commonly seen in type 1 diabetes patients who are on insulin, but it can also be seen in patients with type 2 diabetes who are on insulin and some oral diabetes medications. So, what is hypoglycemia? So, hypoglycemia is low blood sugar, and the blood sugar is normally in the range of less than 4 millimoles per liter, or in, for example, in states and India the measuring units are different. It will be less than 70 milligrams per deciliter. The way to remember is, the easy way to remember is 4 is the floor. So the hypoglycemia can occur very suddenly. Hence, the patient and also the people around them have to be aware of the symptoms. Hypoglycemia sometimes can be life-threatening, so they have to be aware how to treat hypoglycemia. So what are the symptoms of hypoglycemia? In the initial stages, patient might have sweating, feeling tired and hungry. They might be tremulous or shaky. They might have tingling in their lips. They might have fast heart rate. They might be easily become annoyed, angry, or emotional. In the later stages, they will feel weak and sleepy, blurred vision, unable to concentrate. They might be showing unusual behavior. For example, they might have slurred speech as though they are drunk, but they have not been drinking. In the latest stages, they might be having seizures or fits. They might even collapse or lose consciousness. So, how is hypoglycemia diagnosed? Because the symptoms which I just mentioned, a lot of other medical conditions can give rise to those symptoms. If the patient, obviously, if they know that they are diabetics and they're having these symptoms, they can do a blood sugar. Or if you're a family member or a colleague or a friend who is with a patient who has got diabetes, who is on insulin, you can do a blood sugar test using a glucometer, a finger prick blood test, which is the traditional way of doing. But of late, a lot of patients who are type 1 diabetics and also type 2 diabetics who are on insulin will have a continuous glucose monitoring machines. Generally, these monitors will start bleeping and warn you that your blood sugars are dropping. So when it is confirmed that the blood sugar is less than 4 millimoles per liter or less than 70 milligrams per deciliter, you would have made a diagnosis that the patient is having hypoglycemia. So let's come to the classification of hypoglycemia. Hypoglycemia can be classified as mild, moderate, and severe depending on the levels of blood sugars. It is called mild when the blood sugar is less than 4 millimoles per liter or less than 70 milligrams per deciliter. It is called moderate hypoglycemia when it is between 3 to 3.9 millimoles per liter or between 55 to 70 milligrams per deciliter. It's called severe hypoglycemia when the blood sugar is less than 3 millimoles per liter or less than 55 milligrams per deciliter. So in this video, we have covered the definition of hypoglycemia, classification of hypoglycemia, and diagnosis. In my next video, let's look at the treatment of hypoglycemia. Thank you.